welcome to another episode of the Let's Get Comfy podcast. I'm your host, your favorite black bearded bald guy, Norman Harris, owner and CEO of Comfort Measures Consulting. And yet again, I have another healthcare titan on the platform with us today. Thank you for joining and tuning in, Miss Jessica Cashaw. Thank you so much. I appreciate you joining the platform, ma'am. And as tradition, I always let our guests, I put you in an uncomfortable situation right up top with introducing yourself. And I want you to go crazy and brag because you're well accomplished, ma'am.
So, good morning. My name is Jessica Cashaw. I'm a BSN RN, and I am currently the Chief Nursing Officer for Vivo Healthcare. I started my career 13 years ago. I started as an LPN in pediatrics, and I was a school nurse and did a variety of things with kids. And then I pivoted 10 years ago into geriatrics and long-term care, and that's where I found my passion and my love for healthcare and what I do. So I was a unit manager. I worked in MDS. I worked for a very tough administrator who at the time I hated, who now knows that I don't hate him and he knows who he is.
He knew you hated him at the time?
Oh yeah, no, 100%. 100% he knew I hated him. But he said that if he didn't keep me busy, I would be bored. And so he made me learn everything and anything there was to learn in that facility. And I took it on and I went back and got my RN and I continued working MDS and full-time at the hospital. I did both. And then I made my way into a risk manager position and then DON, and I left the hospital at that point. It was too much, and then I worked my way up to a regional nurse, to a senior VP of clinical services, and now the chief nursing officer for Vivo.
Big dog. Big dog. I love that. Ms. Cashaw, well accomplished, and we're going to get right into it. So I don't want to start on the edutainment side of things, entertaining. So if you had a superpower as a nurse, and just for nurses in general in long-term care, what would you choose for that superpower to be and why?
Is critical thinking a superpower?
You know, I think it can be.
Yeah.
Yeah. Tell us why.
I think that it is probably one of the biggest things people struggle with. I think that they can understand the book work, they can understand, the why behind things and the science behind it, but to critically think on their feet and to be able to kind of problem solve and work in tough situations is one of the biggest struggles that some of the nurses have.
It's good. That's a good one. And I think you're a very good critical thinker too. You have to be if you rose to chief nursing officer. So the taxing amount of stress you probably deal with, oh my God.
I think sometimes it's my job to critical think for others. Sometimes, it's a hard skill to teach, one of the hardest skills to teach, but you have to work around it.
Gotcha. So as chief nursing officer, what are some of your must-haves on a daily basis? Like, to just take us through, like, from the time you wake up in the morning, and like, if your day by 9:30, these are the things you need to have.
So I have to start every single day with a coffee protein shake. That's my thing. It's every single day I have to start with that. That's what gets me kicked off. I think, my routine is pretty important. And I think because the whole day just goes wild after a certain time of day and you just don't know what's going to happen. So I think my morning routine is pretty important, where, my staff members know what time they can call me by. So usually 7:30 is the time the calls start coming and kind of, getting a recap and, what's going on. I spend a lot of time in the car, a lot of time driving. So I have people who will read notes to me and find things in charts for me or tell me things that are going on. And I think those conversations that I get to have with some of my employees in the morning are crucial to starting my day to kind of see where we stand.
Right. I like how you put that too. Yeah, they know when to call you. But I want to just share with the audience too, persistence is key. This has been in the works right now, this interview today. How long, Mrs. Cashaw? It's been a little while. I didn't give up.
The
just
one
know
email
that.
was from 2024.
2024, baby. Hey, persistence and consistency. So that being stated, now you've worked many years, working dual roles, working 2 jobs. You have family as well. But one thing people don't really talk about is the pain and body pain that may come from having a career in long-term care. Can you share with us some things that you deal with? Because I work for Evolutionary Healthcare and I do presentations about neuromuscular, skeletal issues and chronic pain. So I wanted to just get that from you because I'm pretty sure long years of, lifting and standing, that it comes with some issues. Tell us about that.
Well, I think people don't even understand like the different types of role you can play as a nurse. So when I was a school nurse, literally I would be running to locations. I would be running to the gym. I'd be running to an outside court. I would be going whatever and taking care of them. So you're on the ground, you're in the dirt, I mean, sometimes those kids get a little rowdy. I've had to, do some interesting things. So from that aspect, but then also, being stooped over a bedside or, I'm tall, so working with other caregivers and you're trying to boost people.
Yep.
Well, I'm way taller than that person, so guess what? My back is taking the brunt of it because they need to be lower.
You're right. You are kind of on the taller side.
I am. I'm 5'10".
For a woman, yes.
Yeah. So to be, I'm like, okay, well, you're 5'2", so we got to go on your side because otherwise you're not going to have any, pull to lift. And then
they probably like, call Jessica. Call.
I'm like, I can reach the stuff on the top shelf, but they, I think that your back takes a huge hit on it. Doing CPR, that's a lot. It's a lot on your body, and you don't get to pick positioning, and you hear all the. Oh, lift this way and do this. Well, you're in situations like that. You don't get to pick how you're doing it. And I think even now that I'm less involved in the day to day, but the traveling I do, the sitting in the car, I have terrible like sciatica in my left side that just kills me all the time. So, and I think it's from the years of strain, but now I'm straining it in a different way with with the sitting in the car for extended periods of time, getting from building to building.
Right. Any other I guess pains and issues that other nurses report to you that they deal with? It could be pain in the body or it could be mental stress. What do you think?
I think that, nurse burnout is a huge thing. So there's a fly.
I know, I'm sorry.
It's okay.
I had a fly swat, I was swiping. Go ahead.
But I think nurse burnout's a huge thing. And I think the mental toll it takes on you sometimes. I think, having your patients, pass away, dealing with sometimes the families and dealing with, what you go through. I think, there are days you come home and you just, there's days I go home and I have no desire to speak. I don't talk. And my husband says, like, you're not talking? I'm like, no, we're done talking for the day. All talking is done. Because you just are talked out. You've talked to everyone and you've given all you have. So you just sometimes you run out. But you can't run out with the patients and you can't run out with the family members. So
I know. So when you get home, you just really I just want to relax and just chill.
I just need quiet.
Just quiet.
So, it's not even relax and chill. It's just quiet. Just no talking.
Right. And just dealing with some of the things that you had to just experience so far. Just talk us through just transitioning, like from. When you've been through acquisitions before, facility ownership change in the post-acute space, what's one thing, because right now you're part of that with your current organization, what's one thing you bring from a leadership standpoint to help to improve that experience?
So I think that being on both sides of it, especially being on the side where we're being kind of turned over consistently, has definitely changed the way I approach it when we go in and we acquire new facilities, because I know how hard that is and how much fear comes with it and how much you're like, what's going to happen to us? So I think the biggest thing that I try to bring to them is that I understand, because I've been there, done it, got the T-shirt, the postcard, all of it, but that the culture, you could say a sniff is a sniff is a sniff. You know what I mean? Like long-term care can be long-term care. Like we're all doing the same thing, but I think it's about the culture that you provide for the staff and how you make them feel, and that they know that they can trust you and they can turn to you, and like what you're going to do for the culture of that facility to make your employees feel appreciated and that this change is going to be a good thing for them. And that approach I think is really important.
Okay, so what inspired you, like, to just turn long-term care challenges into opportunities for quality and advocacy? Because just the number of years you probably touched so many families' lives, impacted the community just such in a special way. And as I say, for this platform, we're about celebrating and turning our healthcare professional into celebrities and heroes, so to speak. So just if you could speak on just what inspired you to tackle this wonderful challenge.
So I think it started when I was extremely young because my father was a quadriplegic. So my father got polio in 1948. He lived in a hospital. He was on a March of Dimes poster.
Wow.
All the kids with the iron lungs and all that. So he lived in a hospital for 5 years, and so he was a quadriplegic my entire life. So I grew up with Hoyers and slide boards, and then in fifth grade I
What
was
age? Do you remember the age?
how
How old? Like,
how
do
old
you
was
remember?
he?
Not with you.
So I was not born yet when he got polio.
Wow.
So because it's not
So your whole
it's,
life.
it's not a quad injury like a spinal cord injury. Polio affects you and paralyzes you differently. So it's not like your spinal cord where you're still not functioning.
Yeah, educate me on polio and the audience too, because I'm not familiar. Yeah. Mm-hmm.
So polio is obviously something that we vaccinate against because of the absolute epidemic that it was back in the 40s and early 50s. One of the presidents had it. It causes paralysis. Your nerves and your muscles continue to die, and even after the polio virus is gone per se, you have something called post-polio myelitis that continues. So your nerves and muscles continue to die afterwards. So like when I was little, my dad used to be able to use these two fingers to squeeze my hand, and then as he got older, this one stopped working, this one stopped working. So like because it continues forever. So when he was able to be more of a manual wheelchair as a young man, as I knew him, he was always in an electric wheelchair. He always had to be transferred and cared for. But my father was a pastor, so we used to go visit people in the nursing home. And we used to go to funerals, and we used to, because he would do all those things. That was his job as the pastor, to see the folks. And I think seeing the bad connotation that nursing homes had then always kind of resonated with me, because it was like, oh, grandma's got to go to a nursing home and she's just gone there and left to die. And I think that always was like why is this is the reputation that it has. And I think it's become important for me to know that that's not what this is. Like our company has a regional director of activities, and we call it regional director of life enrichment, because this is these people's home. This is where they live, and so we need to make that environment reflect that. Like right. This can't be about, this is not about just where you put grandma to go die. That's not what this is.
Right.
So I think that was my original inspiration, was like making people know and having them understand that this was different. This is a different environment, and that's not what this is anymore. This fly really likes me.
I know. I'm sorry.
It's okay. So that's kind of the what my original thing was, but just kind of in seeing the reputation and how you could change that, and how you can make it different, and how it's just a different environment now with the vendors and the people you bring in, and having specialty wound care programs, and having different services like the OMT that you can bring in to show that this isn't your old time grandma's nursing home that you used to come to. This is their home, and we want it to reflect that way.
So with polio, is that similar to, does it have similar effects like with ALS?
You could say that. You could say that.
Okay.
Yeah, you could say that.
I was just trying to compare it to something.
It's a viral disease, and that's what it is, and that's obviously why we vaccinate against it. But it's just the after effects of what it continues to do, and that post polio, So.
Oh, they say healthcare is not interesting. I beg to differ. At Comfort Measures Media, we're proving every day that healthcare is entertaining, educational, and full of stories worth telling. We deliver knowledge, resources, and real advocacy in a way that engages, inspires, and connects. Florida, #1 healthcare edutainment station. I am Norman Harris, the networking solution. Let us highlight your organization and give it the voice it deserves.
Essentially been a caregiver your entire life. So when we look at sponsorships out there in healthcare, we know healthcare a lot of times focus on, attending conferences, seminars, and those type of things. But how can you can assist them with aligning their mission, aligning their brand with, the supporting of caregivers, I would say?
So I think that it's important for, obviously, I try really hard to, have a good handle on who's in our facilities and what care they're providing. But I think it's important for those people to also have a relationship with the line staff, the floor staff that's there, that's providing the care. So I always have doctors call me saying, "Hey, how can I get more referrals? Hey, can I get more referrals?" It's impossible for me to manage your referrals for 17 facilities.
Right.
It's just not a reasonable task. And I take on unreasonable tasks, but that's not one that I can do. So when the floor staff know you, they know that you're coming to see their patients. They know they know who you are and what's going on. They're the ones that are there that are calling that physician saying, "Hey, can we have this referral? Hey, can we we do this?" Or, "Hey, talking to the DON saying, 'Hey, I think this person would benefit from this. Can we do this?'" But they have to be bought into it as well. So we do conferences where all the administrators come. We do conferences where all the directors of nursing come. But we don't do anything to make sure that the line staff know who you are and what it is that you're doing and what you offer to the patient.
Pay attention.
And that's what's important. And I think being seen, the other thing, as I always say, is the patients are my customer and your customer. But we are also your customer. So this has to be a partnership where we're working for the same common goal, which is the patient.
Right.
Where we can all work together, and there has to be a benefit on everyone's side, but getting those caregivers bought in, I think is key.
I was about to say, because if you go into a facility when you round, right, and the DON, the ADON, the unit managers, they're coming to you, "Hey, we need to consider having this particular specialist come in. We really love them," or you hear that consistently, then you're more prompt to say, "You know what, let me look into this." Or you keep getting forwarded in a particular email, right? Like I do.
I had a facility just recently that we took over, and earlier this year, and I'm like, "Okay, who is your cardiologist? Who is your nephrologist? Who is your dermatologist?" So the administrator tells me there's no dermatologist. The marketer tells me there is a dermatologist. Like, they don't know.
Oh, wow.
So if you're not present and you're not making yourself known to that floor staff, and you just signed up with somebody, whoever their previous corporate was, nobody knows who you are. So you're not no one's referring to you because they don't even know you exist.
Right.
And that's the key, is making sure that you're present in that space, and that that you're talking to that staff that know that you're there, because they'll remember the name. They'll remember the name on your shirt, or whoever they're speaking to, or that doctor who they work for, when they see you, because they're busy.
Right.
So your visibility is key to you being successful in that space.
That's a good answer too. All right. So overall, this is a show we advocate for families, caregivers, definitely. And I want you to, when you say your spiel here, I want you to look in the camera, because I want a good clip of this. All right, because I know you're gonna say something great. What is your overall message to caregivers from a lifelong caregiver? You can kind of consider yourself that. What would you say your special message for a caregiver in general? Because as we all know, and if you don't know, you can look up and research this. Sometimes caregivers don't take the opportunity to care for themselves. And I want to say the percentage is around 40 to 43% of caregivers actually pass away prior to the patient or the loved one that they're caring for. So what is your message to caregivers?
I think my message to caregivers is to always remember your why. And that's really hard. It's really hard to remember your why, and how you ended up in this, how you ended up doing this, how did I get here? And I think you get so caught up in the day to day, and and that burnout is always just one click away. So remembering why you got here in the first place, how did you come to this, and trying to recenter yourself to where that came from, and why you wanted to do this, and why you wanted to be part of taking care of other people, is an important factor in recentering yourself when you feel like you are ready to just go over the deep end. And it happens, and it can be sometimes over nothing, but sometimes you have to stop and recenter yourself and say, this is why I do what I do.
Got it. That's a great answer there. I want to also ask you, as a clinician yourself, looking back over just your life in its entirety, what's something that you'll share for just people out there to say, here's an underutilized resource or underutilized service, or just any guidance you can have for families out there to take advantage of new innovation? I mean, we have AI now, we have more technology out there for families, but just for them, give them a resource to actually utilize, whether they're caring for someone at home or if they have a patient in the community at a community facility?
That's tough. That's a tough question. So I think that something that is completely underutilized that I see is like the biggest struggle for families is some sort of planning service. Like not like they don't understand the process of what happens when I always tell my staff, no one chooses to go to the hospital and just never go home again.
There you go.
I will travel far and wide to not have to stay in a hotel because I want to sleep in my own bed. No one gets up in the morning and says, I'm just never going to sleep in my own bed ever again.
Ever.
Like that's not how people work.
This house that I've paid for 20 years.
Yeah.
I had this life event happen. I just woke up and I was on the floor, and now I'm going in the ambulance headed to the hospital, and I won't return back to that house.
Yep. And that's not a conscious choice people make.
Nope.
And so when they are in that situation, they don't know what to do, and they don't know what their options are and how to kind of navigate this entire situation. And a lot of that is on us to help them with. But I think outside of that, having a resource and understanding some of that planning, I saw a very, very sad case a few years back of a young woman who was in her 30s with brain cancer, who had a significant other who she had a child with. They weren't married. And the mother was then the next of kin. She had no power of attorney. She had no documents in place.
Wow.
And the mother didn't want to let him come in, didn't want him to know anything. It was one of the saddest things I ever witnessed. And I literally went and made my power of attorney, my living will, my kids think I'm absolutely insane. But I'm like, I will never be in that situation to where I don't, there's any sort of dynamic like that, and people think, oh, my family would never do that. My daughter would never do that. That's just, you can't predict how someone's going to react when they're in that situation.
You don't know.
And so I think that that's something that families really to have some sort of planning support advocacy service. I think that that's something that people could really benefit from as far as transitioning into this long-term care setting.
Give us a call at Comfort Measures Consulting. We just do
we do
assist. Yes, we do assist with family planning services and advocacy. We may not have all the services, but I can connect you to someone that does. I promise you that. All right, but yes,
that wasn't planned. Good.
I know. Oh yeah. So, but yes, that's a wonderful thing that you stated there. Elder law attorneys actually assist with that process. But again, healthcare is always something typically people run to when you're in need. But that's why I created this platform to provide health awareness, health prevention, and help bring that attention to these type of scenarios sooner, right? Because these conversations can happen.
People don't take care of their health. So I see this a lot of times with return to hospitals when people want to go to the hospital, and I'm like, why? They want to see a doctor because in the community, that's what they did.
Yep.
In the community, they didn't go to the physician. They just went to the ER when they needed something. So then they think, okay, no. I'm like, no. Let's talk about the physician here. And we have a physician, and and that's why a lot of times these ancillary services, having cardiology, neurology, and OMT, and all those different people coming in, they see that person and they know they've seen a doctor, and just that alone, even if they don't have a reason to go to the ER, but just that alone, them seeing a practitioner of some sort helps reduce that, because that's what they did in the community. And we have to kind of change that mentality because they didn't have a steady healthcare system. They weren't going to a physician regularly, like they're,
Right.
or they didn't have access to it.
Have access to it.
Yeah.
I'll speak to an upcoming, let's say, student, right? Graduating senior year, going into nursing school, that journey. Just take them through some things that they may encounter in life that may deter them, but keep them on track.
So I think the most important thing, nursing school is probably one of the hardest things I ever did. And I did it when I had 2 kids, so that, and then RN school when I had 3, so I just kept going.
I wonder if that's and I'm sorry to cut you off. I wonder if that's like what builds nurses, like it make you all so tough. Y'all deal with so much like personally, but still have that dedication to like be career oriented, task oriented, goal oriented, and still accomplish those things. Because I'd be thinking like, how nurses, DONs deal with all this? Like I have DON, I know a DON, she would be in school, had 5 kids, a husband. She's still director of nursing. How you do all of those things?
So this is what I always tell people. If you have the heart to do it, you have the heart, you have the want to, you have that drive, I can teach you anything. So I can teach you to do all kinds of stuff. But if you don't have those pieces of it, then you're not the person that I'm going to be able to teach to do those things. So that's the thing. You have to, when we were in nursing school, there's always kind of a joke. There's some people who are there to be nurses. Some of them are there just to meet an MD because, they want to, marry up, there's different kind of folks. So you have to have, it is not for the faint of heart. Nursing school is extremely difficult. So, if you can get through that and you've made it through the hard part, then you have to find what drives you. There are so many kinds of nursing. I have friends that do every aspect of nursing on every scale. And you have to find what works for you and what drives you. The hospital was not for me.
Wasn't for you.
I tried that and I was like, I'm not doing this.
Why? Tell us why.
You know what? Because I had worked in long-term care first, I think didn't help me. But I said, this is why my patients come back to me with wounds. This is why my patients come back with matted hair. This is why my patients come back dirty with, a Mepilex stuck on every bony prominence in their body.
And it happens fast too.
They're just because there's no actual, it's just about whatever the acute issue is, length of stay, in and out, turn and burn them. That's all it is. There's no actual care that you're providing.
Because a patient could go in the hospital for 3 days and come back with a wound, fast.
Yeah, because there's no concentration on moving them or making sure that you're doing anything. And the nurses, are absolutely, insane, going crazy. The tele unit's calling you every 5 seconds to tell you your monitor. I'm like, yeah, I got it. I see she's in AFib with RVR, and I'm trying to get an order to push cardizem. Stop calling me.
Got it.
But and then everyone else is just kind of left sitting there, and maybe they'll get their morning meds because you have that one patient that's crashing. And what are you going to do? I worked for a hospital where I had to, and it's local to this area, I had to move my own patients to the ICU. I'm like, okay, well, I guess,
Wow.
And we were running a code on a patient once, and I said, hey, who watches the rest of the patients while the entire floor is in here? How do we make sure they don't fall? How do we make sure they're not on the floor? If everyone is in this room and some of them are just standing around, you don't need 20 people to run a code. And you have the ER doctor that comes up. You know what I mean? So it's not the same as running a code in a sniff, but I'm like, who watches the other people? They'll think I was crazy. I was like, you can't have everyone off the floor at once. Someone has to watch the other people. So it's just a very different mentality than working in skilled nursing. And it's just about, and I knew the people they would discharge. I'm like, see you in a couple of days because you'll be readmitting.
Wow.
Yeah, because you just knew they weren't stable. But it's about length of stay, get them out, churn and burn them. Just whatever's acute at that moment. The rest of it, let's go. That's it.
From your experience, and you may not know this, or you may do you feel like nursing homes are far more regulated than hospitals are?
Oh, for sure. Absolutely. Yeah. So, in the hospital, you worry about Joint Commission, and then ACA does complaints in the hospital. But it's not the same survey process, and they don't have to run on the same regulations, which is why, they don't care if they send wrong paperwork or do whatever they have to do, because it's just not regulated the same way. As to where, obviously we choose to do Joint Commission, so that's something that we we torture ourselves with.
Yes.
But, but the regulations are absolutely insane for a nursing home compared to a hospital.
Wow. And they make more money. It is a business. So just from your experience though, with working in the hospital and in the nursing home setting, just overall, how can someone do both? Because you have the nurses that work in both settings. I do have nurses and I have nurses that work for me right now that work in both settings. And I think, so one of the nurses in particular I have that works in both settings, I think that, she ends up seeing a lot of our patients kind of come through both ways, ones that are being discharged to us, ones that are, going back and forth. And I think sometimes for them, it's kind of a little bit of a continuity of care, but I think it's tough, and it just takes kind of a special personality to be able to kind of work in both worlds and have that just kind of be okay. But yeah. Right. So you mentioned something earlier. You said there's also those nurses, and this get a little messy here, all right?
Okay,
And
messy. I love that.
you said there's also those nurses that go to school and in hopes of landing an MD.
Mm-hmm.
Yeah, tell us about that mentality right there.
So so my friend's mom, who was an RN, and she went to the hospital for 30 years. She had talked to me about that once when we were in nursing school. And it's just like you can see there's like a different mentality in people that are in nursing school, and they don't. They definitely struggle more because they're going through it because they think that they're going to have like this come up. Well, I'm going to meet a doctor. I'm going to work at his office, and I'm going to do this, and it's going to be this cakewalk versus I'm going to be the nurse doing all the hard work, and they just have a different mentality, and you see them struggle different. You see the difference because it's something you have to have a passion for. You have to care about. If you don't care about being a caregiver and you're looking for a come up,
looking for that come up,
then
So-
they don't survive oftentimes.
So like the Grey's Anatomy type of shows and stuff. We watch Grey's Anatomy.
I don't watch a lot of TV, but
Oh, you don't?
sometimes I watch Grey's Anatomy. Yeah.
Okay, but is that true? Like that kind of see, because it's like it's a bunch of sex, it's a bunch of drama and all kind of stuff in the hospital.
I think that you do find some of that goes on. I think more so in the hospital than you do in skilled nursing. But sometimes it happens. I have husband and wife teams that work. We just have to be mindful. About positioning. But I mean, sometimes you. I guess find love where you work. I don't know.
Find love where you work.
So that I have a policy against that personally.
You know what? We don't need to come up with a reality show like that. Finding love where you work. That sound like a good name too. Love in the workplace. Yeah. We need to copyright that for real. All right. So we shifting gears here. We're gonna talk a little bit about Jessica on the personal side, life segment. So Jessica, if you share with us, what was your biggest pivot in life?
I think my biggest pivot in life was kind of deciding to change the future for myself, for my children, from how I grew up and from the environment that I grew up in, and changing that my career. Some people are a product of their environment, and I decided to be, despite my environment, what I was going to do. And when I made that decision, because my 20s were rough, when I made that decision to kind of move forward and say, you know what, no, I'm gonna get a career, I'm gonna give my children something to be proud of, I'm gonna break the cycle. That was probably my biggest pivot in life. I think was kind of trying to change that and what that took to accomplish.
Got to talk about what it took. Give me three top things, whether it's a particular skill set you had to learn or three things you had to overcome.
So the first summer after I graduated from nursing school the first time, I lived in my car. So
the whole summer
I lived in my car.
You had AC. You had AC, right?
So in the car.
Yes, gotcha. Okay.
I did. I had a little Hyundai Sonata, I think.
Really?
So I lived in my car. So that was something because I had to. It was a lot with the kids and being divorced and trying to go to school and trying to make all that work. And nursing school was full time, So
Wow.
trying to make the whole thing work. So I lived in my car for the summer and saved every penny I had so that I could get an apartment and live near where I worked. At that point, I was working in 3 counties. I was working in Pasco, Hillsborough, and Pinellas. And I would drive in a triangle almost every single day for all of the different things I was doing.
So it's possible to almost live in the car because you was probably getting at work at different times.
Yeah, no, it was.
Wow.
It wasn't ideal, but that I think.
Right, I know. Yeah.
But that was.
You definitely like to have a home.
Yeah. So that was what I had to do to get it together for initially. So my ex-husband had summers for the children, so it worked. So I wouldn't have done it with my children. I would have figured something else out. But for that moment, it was like, I'm going to grind. I'm going to work, and I'm going to make everything I can. And by the time my kids come home we were to start school, they're going to have a place to live, and that's what it's going to be.
Motivation, baby.
Yeah. So
do your kids know this story? They know now. Yeah.
I don't know.
So,
I don't know.
Y'all need to be thankful for mama. She went through the hardship with you.
So,
never turn your back on mama.
Yeah. So I think that was one of the hardest. And I think the other thing is just like be doing the nursing school thing, like doing that, and because it is so full time. So because I had, I had done it. They used to not have like a 12-month program. I did like a diploma program, so it was an 18-month LPN program that I did, and that was a long, hard battle to be able to have to do that full time. And they had rules: you can't work within this many hours before you start a clinical at this place, and this and that. So it was a balance for sure.
Right.
With my, with having the children and doing all that.
So that's why when I invite clinicians and leaders on the show, I say brag on yourself, because everybody that I've had on the show that's been a nurse or an advocate of some sort has a journey, has their own story that they had to overcome, and that should be championed because it's hard. It's a lot of hard work. I didn't have that same story. I really don't. Yeah, I really don't. So I thank you for sharing it. Thank you for being vulnerable to do it too. But let's talk about just marriage now. How that established your balance, and how do you, what things did you do to support your work-life balance overall?
So work-life balance is I'm the worst at that out of everything in the entire world. That's what I'm the worst at, is work-life balance. I'm married to my job and my husband. It's kind of a thing. So fortunately, with my husband's career and what he did, he, being a Marine for 21 years, he was deployed. So he was deployed 18 months at a time. So he understood, like, work is work. And when I have to work, like, I can't be kind of worried about what's going on at home, because that's how you got killed in war, right? So worrying about drama at home. So he continues to carry on that mentality where he does not call me when I'm at work. Like, it would have to be like a crisis. Like, I don't even know if he one time had a bolt fly off a thing, hit him in the face, cut him from here to here, tried to take himself to the hospital, got pulled over, ended up with a police escort, did not call me for the entire situation.
Wow.
Like, they're doing plastic surgery on his face and like didn't call me because he won't bother me when I'm at work. Wow. So because he's like, you're at work and that's the priority. And so, but at home, he is definitely like my piece. Like, he keeps the home together so that I can do my job. So if it wasn't for him, I would say I'd live in like a studio apartment that needed no maintenance, because I couldn't do both. I couldn't maintain the house and all the stuff that has to be done and do everything I do for my job. So he is that piece, and he provides that balance for me. Otherwise it wouldn't be possible. So yes. I just couldn't do both things.
Was that something you all had a conversation about, like, prior to getting married? Like, hey, this is my life. This is how things are going to be. Like, did you lay that foundation up front?
So I think that, so we've been together 10 years. So he's watched this progression and this growth, and he knows how important this is to me. So I don't know that it's ever a conversation we've directly had. He's just always been very, very understanding. And it's part of the reason why I stayed with him, because I'm like, my career is really important. I've raised my children. My children, are, on a level now where they can, I waited till my boys were in high school to go to RN school, because I was like, I need to focus on them. And one of my children has some like medical issues. So I waited till there was a better time to do it. So it just, he saw what I put into it, and that's what it's going to be. And he just has that's his mentality as far as the work situation goes. He just is like, you're at work, and that's that. I called him the other day at work, super excited. I never ever call him, but I was so excited about something that we pulled off that I had to tell somebody. And he was like, "What's wrong?" And I'm like, "Nothing's wrong." He's like, "Jessica, what's wrong?" I'm like, "I swear." He's like, "Because it's not something that we do." He just holds down the fort and takes care of it, and that's that.
Well, give a special message to your baby today. Yeah, make sure you look at the camera too. Yeah.
Tim, I love you. Thank you for holding it down all the time and keeping everyone in the middle of the road for me.
Yeah, we're gonna put a little heart over this message too. Very nice. So,
him and I are not warm and fuzzy people.
Hey, it's gonna be a warm and fuzzy moment on the comfy. We getting comfortable. So a big shout out to your marriage. Much success to you both. I know that balance is very important for sure. Having someone to go home to is very important too.
I tell him that he gets 1 week a year and Vivo gets 51. So 1 week a year for our anniversary, he gets a week of vacation.
Oh, man. All right. So just sticking with, your personal story and journey, if you could share with us just a ritual or a family tradition that you remember from your childhood that you really, enjoy it. And then if you would share the opposite, a childhood memory that's something that you just wouldn't care to even talk about.
Oh, so we'll talk
Yeah.
about it anyways. Okay.
Mm-hmm.
So I was a very interesting child, as you probably could imagine. But I grew up with my father and my grandmother, and it was an interesting dynamic. It was my mother's mother, but my mother was not in the picture, so it was the two of them. And my grandmother was a sign language interpreter. And so every Sunday I would go sit with the deaf people at church, and I would watch her interpret and just hang out with all the deaf folks and watch her interpret all the church sermons. And I didn't want to go with like the kids in the kids session. I just wanted to go sit in church with her and watch her.
So you know sign language a little bit?
I know a little bit of sign language, and I'm not doing it.
Can I do it? Can I do it? Just tell me. Oh, shoot, I hit the mic. I don't want to do it.
Just watch Miss Rachel. You got little kids? Watch Miss Rachel.
Miss Rachel. Okay. I'll do that.
Yes. So my granddaughters can do a little bit. You do more, please. They can do a little bit.
So did she understand like Braille, how to read Braille?
That's for blind people.
Oh yeah, damn.
She did that.
Hey, we're going to cut that out of the show.
So what we did have in our house was a TTY, and I don't know if you've ever seen these TTY. They're special telephones for deaf people. Mm-mm. So they're very, very interesting, where you can type on them and then someone kind of translates it. I haven't seen one of them in a bunch of years, but I had one of these in my house so that she could have phone calls with the deaf folks.
Wow.
Yeah. Mm-hmm.
You're just a bundle of everything, aren't you?
You have no idea. We haven't even cracked the iceberg.
Goodness gracious. But yeah, so that's you consider that a fun memory, or
it was I absolutely I love my grandmother, and it was absolutely just a great memory that I have, from being there,
Okay.
So.
All right. So let's go the opposite.
Okay.
Mm-hmm.
There's so many. There's so many. I think that probably the biggest bone of contention is probably, my biological mother. That's probably the thing. So she lost me when I was 7, my brother. And so my father was a quadriplegic. Okay. In 1987, 88, he was awarded full sole custody of my sister and my brother and I. So my brother was 2, my sister was 12, and I was 7. So that's not heard of now, let alone having a quadriplegic man in 1988 being awarded full sole custody of his children.
Wow.
So I'll leave that with you.
Yeah, gotcha.
So yeah.
Well.
But he was the chaplain at the sheriff's office in Land O'Lakes. He was the chaplain there. He was the volunteer chaplain at the New Ritchie Police Department. He was on staff at First Baptist Church of New Ritchie, and that's what that was, ministry is what he decided to do with his life, and so that's what he did. So that's what we grew up with. It was very interesting.
So I was about to say, you automatically would see just how to not give up. He still pushed along.
Well, that's the thing. So if you can, and he lived a considerably long time. So if you can do all of that and accomplish all that without the use of your arms and your legs, with your all the stuff that transpired, why should I not be able to do whatever? You know what I mean? So that if he can do that, I have nothing to complain about.
None of us do.
No, probably not.
Do. Yeah.
Probably not.
So are you biblical?
So I find that there's a difference between believing in God and organized religion. So
do you have any verses you can recite that you remember?
Maybe.
A couple, you got one?
I have one. I think it's one that probably anyone who ever knows anything about the Bible knows, but it's one that I remember I learned it in Vacation Bible School when I was little. For God so loved the world that it gave his only begotten Son, and for whosoever believeth in him shall not perish but have everlasting life. John 3:16.
John 3:16.
Yeah.
Got it. Okay. Yeah, I don't have not one I can, and I grew up in the church too.
I have a incredible memory, like
really
an insane, almost eidetic memory. Like I remember dates, times, numbers, license plates, driver's license. I can tell you all kinds of things. I remember all kinds of things.
Really? So
Yeah.
that's why you remember how long I reached out to you way in 2024.
So I just have, I have a weird memory.
Okay. So I know you said pretty much it's work and husband life for you, but how can we get you to incorporate a hobby or extracurricular activity?
So my hobby, my extracurricular activity is my grandchildren.
Got it. Okay, you do have one.
Yes,
Okay.
that's and if I don't have them, then my hobby is shopping for them. That's what I do.
That's what you do. You love to shop.
For my grandchildren. Oh yes, I have two. They're two little girls. One will be 3 in December. One just turned 1 in August. And so princesses and all the stuff and all the
But they love you, don't they?
Yes.
Aww.
Yeah, and it's fantastic. So
Do they have a special name for you, or is it grandma?
No, I actually wanted to be called grandma.
Grandma,
Yeah.
okay. Because now they have the G-Ma and all those
Mimi,
different
Gigi, all that stuff. Yeah.
Except that you're a granny,
So, my daughter didn't want to call me grandma, and she's like, "You're too young," and I was like, "No, I feel like that's like part of the issue because people do wait till they're in their 40s to have children now sometimes.
Yep.
So people think that I'm their mother. I don't want anyone to mistake me as their mother. I am their grandmother, which is why they can do whatever they want when they're with me." I'm like, so no, I like grandma. My husband is G.
G.
Yeah.
So are you an empty nester right now, currently?
Yep.
Really? You enjoy that?
I do. It was hard initially. Well, like when my daughter left, and then then my sons. But actually, they were just menaces. I would come home and be like, "Why is there a person-sized hole in my wall? We were wrestling with socks on." I'm like, "Oh, good." So after, so I decided to build a house, and then I said, "You guys can't come with me. You graduated from high school. They both dual enrolled and got technical degrees. One's a welder, one's a mechanic.
Oh wow!
And then one's in school because he wants to be an engineer. But so they did. I'm like, you guys now have to figure it out. I'm gonna put everything on the curb, and I'm gonna move out. You have to find somewhere to go.
How big are your sons? Because you're 5'10".
Yeah.
And I mean height wise.
So my one son, actually, I'm surprised he only ended up being 6 foot. Because his dad is tall, and my brother's 6'7".
Jeez.
So I'm very surprised that he's only 6 foot, because even his dad is 6'2". But my other son is adopted.
Oh, okay.
So,
yes. Okay. You said that.
Yeah. So you can't really go by that. But my daughter is as tall as I am.
Really?
Yeah. So
all sport? Did they play any sports at all?
My sons did wrestling, weightlifting, and football. And my daughter was younger. She did sports. She used to do soccer and cheerleading. But then, that didn't
work. Got it.
Yeah, that wasn't her thing.
Got it. Well, they have a wonderful example as you, as their mother, just the stories that you have and possess. I would say, I'm not sure if you do this or not. You probably do. But I will say, just from my youth and growing up, one thing that I miss my granddad, my granddaddy Chicken, we call him Chicken James, but he would share a lot of stories from, his youth and growing up and how the times were in the past. But please do that with your family. Share those stories and your journey as well, because you never know how it will inspire them.
Have you met these new Gen Z folks?
Yes, I have.
So this is what they tell me, that I have survivor's bias.
Wow.
Do you know what that means?
No, everybody have a label now for something nowadays.
So I'm like, we used to drink out of the hose. And they're like, you have survivor's bias. I said, what does that mean? Well, it means because nothing happened to me, I think it's okay. But that doesn't make it okay. I'm biased to it because I survived it. Like, so despite of it. And I was like, what?
Yeah, whatever.
So I've been educated on survivor's bias, which is what I have. So I tread carefully with the children. When the grandchildren are a little older, we'll see. But I tread carefully with the children because they're like,
they don't want to hear it.
Yeah.
Well, use it as motivation. It's your mama journey. Nothing like mama, man. So are we gonna end on this note here? And it's a little game, okay? And I want you to go in detail on this because I know you said you only broke the tip of the iceberg, right? But if you would, okay, so it's a game. If you could write a tell-all book, what would it be about? And discuss, I guess, key pieces or details you'll have in your tell-all book, right? And I want you to touch on, if you would, your career, right? And your professional life. I'm sorry, your personal life. A tell-all book.
A tell-all book. So I think it would. I mean, obviously, it would start when I was a child, and kind of some of the things that transpired as a very, very young child, and kind of what effect that had on me. And I think some of the things that transpired, there was kind of like this policy in my house where you don't talk to anyone outside of the home. Like what happens in your home stays in your home. So they don't believe in therapy. They don't believe in telling a doctor or going, I have this cut on my arm here. I cut my arm at a zoo once, and my dad said I had to get a bunch of stitches. He said, "You're waiting till we get back in town. We're not seeing an out-of-network hospital here in Tampa. We're waiting. You're going back." I was like, okay, but like the lack of access, like what that would have been different, because I feel like life could have been incredibly different if there was just a different access to things and what went on, and that
knowledge.
mentality that that went on. And I think it would have to start there. And I was that a little more than what I want to say, but that it would start as a 7-year-old Jessica is where it would start. And then it would continue on, and then to when I had my first child very, very, very young, and we essentially grew up together. And then, and continued on with my other children, and just kind of how that transpired, and how my divorce and that the way things were in life kind of kickstarted me into being like, no, I need this career, and I need to show my children something different. And I think a huge part of my motivation in life has always been, to be different than my biological mother. Like, because obviously when you're biological to someone, like I see a lot of similarities in her and myself, but I want to, make different choices, because as a child, I'm always like, why didn't she pick us? Why did she pick these other things versus picking her children? So I wanted to be the one that picked my children, and make those changes in my life. And so I did. And then just kind of being that young nurse and that baby nurse, they tell you in nursing school in the first year, you're going to kill somebody in the first year. Like, it's an awful thing to hear. You know what I mean?
No,
so I did not kill someone in the first year, but like, that's the mentality you have going into this. So, you kind of work in fear, but just kind of knowing that it's okay to take the time to explore and to see what it is that you want to do and what that looks like for you. Because the same thing isn't for everyone. Just like, I couldn't function without my MDS nurses and my case managers and the different types of nurses that I have. We all have kind of, a niche and what works, and without each other, we couldn't do our jobs. So I think as a young nurse, taking that time to explore and not feeling, I think I sometimes beat myself up, like, the pediatrics was hard. It was hard. And, just kind of seeing the things that, transpired and happened to some of these children, it was tough, and, not that the geriatrics isn't, but, they have a life story.
Right.
And if you sit down and talk to them and listen to them and let them tell you what they've done and where they've been. And some of them, it's absolutely amazing. So that's the difference for me. And the kids were hard. So just kind of taking that time to explore what works for you, where is your heart? Because if you're somewhere where you're miserable and it's not like you don't like what you're doing, you're never going to be successful at it. You have to find where your heart is. And it would go, kind of into what that exploration was for me and what that looked like. Because, a lot of people feel like, okay, they start this job and they do this, and if they aren't successful at it immediately, that makes you a failure. And it doesn't, because you can be, the types of nurses, it's just insane what you can do, So, and whether you want to continue that path. I never had a desire to become a nurse practitioner. That wasn't my thing. To me, it's different type of medicine. I don't want to be out, prescribing and treating and seeing someone for 15 minutes. I want to be involved in the other end of the care. You know what I mean? So that's kind of where, where my heart is. And so, but that's not everyone. And some of them, they want to continue that. And that's fantastic, because we need those people.
Right. So in your tell-all book, would you talk about like what ticks you off? Like what pisses you off?
I could talk about what pisses me off. Yeah. There are a couple things that piss me off.
Like what? Give me one thing. One thing you'll put in your book and talk about.
So my staff would tell you one thing that pisses me off is timeliness.
Timely. People show up late.
Yes.
So I was a little late today, but I was here on time.
No, but the thing is, you don't work for me, so it's
Got it. Okay, gotcha.
Yeah.
All right.
No, but
Sorry.
like when you're having a meeting, when you're having a thing, when you're saying you're going to be somewhere, you should be there. You know what I mean?
I agree with that.
I'm very mindful. Like, I don't schedule a million calls. I'm not doing calls every other day. I'm not trying to take your time away from being with the patients. I think that's important. You know what I mean? And what you're doing there. So when I schedule it, when we have something. Like I like you to be on time, we're having a meeting, you should be on time for work. It's not when you mosey in, that kind of thing.
So 23-year-old Jessica, what pissed her off?
Oh boy. Everything.
Everything.
I was angry. Yeah, I was angry. Everything. Yep. So, yeah, I was living a wild life.
Living a wild life.
Yeah,
you didn't play.
Yeah, it was. Yeah.
You ever get into fights, Miss Jessica? Huh? Because you 5'10", so you probably pretty intimidated, but also too, I know
people tell me I'm intimidating, and I'm all I do is laugh and smile all the time. Like this is how I am all the time.
I'm saying too. I'm just thinking about it in the mind of a 5'2" woman. So women interact differently with each other.
So when I was younger and I was in middle school and high school, I was a very angry young lady. So yeah. Mm-hmm.
Gotcha.
Yep.
So you know how to throw some hands. You're trying to say today.
I'm just saying.
Okay.
I was an angry person, but that is a different person.
And if you would have played a sport, what sport you wish you would have done, or activity you wish you would have done? Did you, or if you even wished, was it an instrument or anything like that?
So what I really enjoyed, even in I had started kind of in some, back in the day they called it gifted. So I had to take these classes. In third grade, I wrote my own will.
What?
And they thought that there was something wrong with me. So they had me examined, and then they did a bunch of testing on me, and they realized that I was bored. But in my mind, I still have it to this day. It was logical. And my sister wasn't always nice to me, my older sister. So I didn't want her to have certain things, and I wanted my grandma to have certain stuff, because I was like, nope, I'm giving it to her. I had no death wish. I didn't know what suicide was. It wasn't anything like that. I thought I was being practical because my father was older, and I hung out at nursing homes and funerals. So, the first time I ever saw a dead body was an open casket at a funeral that I had no idea I was going to see, because my dad would take me along with him. And so I was like, okay, well, I don't want my sister to have my stuff if something happens to me. You know what I mean? So I did. So they thought I was, and then they started putting me in these different classes. So then all my teachers became doctors, and then I was, in these, they called them these gifted classes. So from that point on, I loved creative writing. I can write a paper like nobody's business.
Really?
I love that. So I had this teacher who would just give us a word, and basically it was a contest every single week to see who could write the most words based on that one word that he gave you, and then words like and, if, it, the as, those words didn't count as words. So they had to be actual words, and you had to write a story. And I absolutely loved doing that. That was my thing. Outside's not really my thing. So creative writing.
So you should work on your tell-all book then, the story of Jessica Cashaw. You should do that, because you probably could do it in 2 weeks.
I could do it.
Yeah, if you did time blocking, you would have to be able to time block, because your job is, maybe say 2026, the first quarter, you work on your book. That'd be good. Because once you start it and you see the responses, you're going to want to keep doing it. I promise you that.
I have a friend who did a book, and actually I have two friends who write books. One is a little different kind of book, but I have one. Humility is my thing. So I'm not really showy isn't my thing. Humility is my thing. So.
But you deserve to be, you're the brand of Jessica. I
am a brand. That's
you're
for
a brand.
Sure.
Yeah. You have a lot of experience, a lot of stories that you can shed light on that people could utilize. So, and I want to highlight you in any way I can. I'm going to support you. So I can tell you that. I appreciate that. For sure. You should do it. I'll consider, at least think about it. Matter of fact, what's your husband's name? Tim. Talk to her about this at home, man. Talk to her about it at home. Well, I thank you for joining the platform and the show. Big shout out to your family. I hope they like this. And I thank you for gracing us on a Sunday and doing this. I really do. From the bottom of my heart, I appreciate you, seriously. But thank you. It's another episode of Let's Get Comfy Podcast. We have Miss Jessica Cashaw. Please tune in. Subscribe to the channel. Visit our website, comfortmeasuresconsulting.com. We're more than a media platform. We provide consulting for independent, privately owned organizations. but also advocacy for families to help you with that life planning and stop waiting to the last minute, right? Start having those health preventions, health awareness conversations sooner rather than later, all right? Till next time. Thank you. You did it.
We did it.
We did it. Good job.
Look.
You killed that. What time is it?